If you have the textbook, you can follow the instructions there. Otherwise, you can just listen through the class. So, planning. We all live in a state where we do not know what is going to happen in the future. What planning enables us to do is, at least it makes a route for the actions what we can do in the future. That is the basic simple meaning what planning means. Okay, there are definitions, you can read the definitions later, but just understand the concept now. So planning is a process which involves selecting of missions, objectives and actions. Later we will see each of these word meanings. What are the meaning of mission, what's the meaning of objective, action? Later in the later slides we'll see that. What is planning? It means choosing a future course of action. The things which I have bolded in this slide, pay attention to that only. It will give you the meaning. Okay. Choosing future course of action among the available alternatives. You have many choice, but you choose only one course of action for your future actions. That is your planning. Okay. As common saying, planning involves 5 eyes and one husband. What are the 5 wives here? What, where, when, whom, who. And the husband here is how. What is, as a manager, you should be able to answer these questions when you are going for planning. The planning, your plan should answer these questions. What is to be done? Where it has to be done, the place where your plan should be executed. When, within what time, or when it should start and by when it should end. Whom, to whom you will be reporting the progress of the plan. Who, who are the subordinates in this plan, whom you will be ordering your procedures. And how, what is the methodology you're going to use in this particular course of action to achieve the objectives that you want to achieve through this plan. So these are the important things you just have to remember. It is given in detail in page number 72. Just go through that. Okay. Now the features of planning. Selecting mission and objectives and actions to achieve them. Planning will involve you to select what you have to do, what actions you have to do to achieve the objective of your organization. It will help in decision making. We'll see that how in the progress of these slides, how planning enables decision making. The main component here which you should remember is it bridges the gap from where you are now and where you want to go, from present to future. The bridge between the present and future is what planning, the essence of planning is. Okay. Primacy of planning. Whatever management techniques you do, whatever quality management, infection control management, you go to whichever line of management, always planning is the first step in your managerial function. Nothing presides planning. Planning is the first thing that you have to start when you are in a management. Okay. Pervasiveness of planning. It's not that only top level managers has to do planning. From top level management, middle level management, low level management, even you are in whichever part of the world, if you're having a small business, medium sized business, large business, okay, planning is a very key essential step in whatever management position you are in, wherever in the world you are in. It is pervasiveness. Pervasiveness of planning means it is everywhere. Wherever management is there, planning is the first step there. Okay, these are the few features of the planning. You can just read through it. Next is hierarchy of plan. In the textbook, it is given in a pyramid chart, figure 13.1. Again, same in page number 72. Hierarchy of plans. Here we will discuss in brief what from mission. Mission is the topmost. Mission has a topmost place when it comes to the hierarchy of plan, and the last place goes to the budget. Okay, so from mission we will start our explanation in brief. What is mission? If you ask a CEO of a company or a hospital or any industry, you ask a CEO, the dream that the CEO has or the founder has for his institution, that is a mission. In simple term, the dream, not the dream which you see when you're asleep, with open eyes, the dream that they have for their institution, for their organization, That is mission. Okay, remember that. So in hospital, what will be the mission of a hospital? It's very simple: to serve the mankind, to make community disease free. Okay, and to make a healthy community in general, to help the population get good access to your healthcare. So these are the mission statements. It is general, it's not specific. Okay, it's kind of a dream. It's a vague dream. It's a general statement, and it usually mission and vision is long term goal. If somebody asks you where you see yourself uh, 10 years from now, okay, so the answer you are going to give them should be the purpose of your life or mission of your life. Understood? How we are going to achieve that, becomes the second tier of hierarchy of plans. So the second tier is goals or objective. In textbook it is given objective. Objective and goals can be interchangeably, you can use these two terms. Okay, some authors will say aims, objectives and goals are one and the same thing. So what is objective? How you can differentiate objective from mission? So mission is a general statement, but objectives are not general statements. Objectives are very specific. Okay, you can't just put out a dream out there and say that this is the objective. No, objective is step by step action plans which will lead you to fulfill your mission. It is very specific. Okay, objective may be achieved, it may not be achieved. There are two ways of objective. Either you can achieve it or you will not achieve it. If you cannot achieve it, you have to rethink about your goals and objectives. Okay, so it's ultimately it's a desired state. It's a result oriented statement. Objective is a result oriented statement, but mission is not a result oriented statement. It's a general statement. It's a dream what you have. Okay, next, strategies. Strategy usually it's a top level management tool. Okay, the strategic plans organization have, usually it's limited to the top level and sometimes to the middle level managers. Usually the top level managers are included in the strategic plans, etc. Okay, so historically they say that strategy was came into management from the military services. The kind of attitude the military people have, with that they have incorporated that those strategies into management. So now management also has a definition of strategy. It means that you have few resources and how you are going to use your resources. Okay, resources can be manpower, the number of employees you have. It can be machinery, the equipments you have, money, the financial backup you have. Okay, how you are going to use these resources to achieve your objectives. That is strategy. And usually when in healthcare industry or any industry, if you are speaking about strategy, two things should come into your mind: internal environment and external environment. Analysis of internal and external environment. What is internal environment? It's within the organization, the factors that will affect the top management decisions and goals. For example, the number of employees, policies of the organization, the customer, patient satisfaction, etc. This all becomes the internal factors. There are many other factors. I'm just giving you a few examples. What are the external environment? Your competitors, the policies, rules and regulations of the government, accreditation bodies. Okay, uh, the economy, the general economy of your country. These all becomes the external environment. And as a top level manager, you have to do both internal analysis, environment analysis, and external environment analysis. So this will finally give you a strategic plan. Okay, strategic plan means what? You have resources, how you are going to use the resources to reach your objective. That is a strategy. Now it comes policy. Sometimes you may get confused between policy and rules, but there is a difference there. Policy means, for example, let's say you work in a hospital and your hospital has a medical insurance policy, especially for your employees. For example, the employees can avail a 10% discount from all the services the hospital, if an employee is availing medical services from the same hospital they're working, so there is some benefits to it. Okay, 10% discount some hospitals may give to their employees. So that this become the policy. Okay, so employee can go anywhere else also. It's not compulsory that because they are working in this hospital they have to get treatment here only. The staff have the choice to go somewhere else also, or to avail the benefits which the uh, organization is giving. So providing this 10% off from medical facilities and pharmacy, etc., is a policy that organization is following. Okay, so remember this example. So policy means what? It is general statement that the top level management makes. For example, just I gave you the medical insurance policy the hospital is giving to the staff. Can a department uh, make this policy? Can a nursing department make this policy? No, they cannot. They are not authorized for making such policies. Only it should come from the top management, and the subordinates, the middle management and the lower level managements, they have to follow these guidelines. So that's the policy. It's made by the top management. The others have to follow it. It applies equally to everyone. Okay, that's policy. Procedure. You all know what is SOP, standard operating procedures. In various departments, especially in laboratories, etc., there are SOP manuals for each and every procedure that takes place within a healthcare industry. Okay, that becomes procedures. Procedure means what? Step by step you have to follow. You can't follow the third step first and then do the first step. No, step by step in an order you have to follow the guidelines. What action you have to do, actions, guidelines, step by step it is mentioned. You have to follow that order only when it comes to procedures. Now rules, where sometimes you get confused. For example, in policies I told you, the staff has a choice of availing the services given by the hospital or to go somewhere else. Okay, but in rules you do not have the choice. For example, you have to come to your work sharp at 9 a.m. Okay, you can come 5 to 10 minutes early, or you can come early. That's not an issue. But if you are 15 minutes late, you are answerable for your deviated punctuality. Okay, that's rule is either yes or no. Are you following the rule or are you not following the rule? There is no gray area when it comes to rules. But in policies, the staff have choice. There are some loopholes in the policies that the staff do have, can exercise a bit more freedom as compared to rules. Rule is a straight yes or no answer. Were you present at 9 and by 9 a.m. you were in the duty or not? If you are late, you are late. If you came early, you came early. That's it. So that's a rule. So that's example of rule. I think so you can understand what's the difference between policy and rule. Now programs. You all must be aware of the national health programs. Okay, for example, the RNTCP, Revised National Tuberculosis Control Program, etc. Okay, the program itself is a mixture of goals, objectives, things we have discussed so far: the mission, goals, strategy, policy, procedure, rules, etc. Everything is mixed up in a program. The program itself will have a mission statement. The program itself will have a objective, strategies, policies, which the state level government, the central level government, the district, the municipalities, everyone have to follow that, especially when I'm talking in terms of national healthcare programs, etc. Okay, so you can name any national healthcare program and you can just go to their website and read about it. You will understand what was the mission, what was the need of this healthcare program in the first place, and the program, the board of governors in that particular health program, what goals they are applying, what strategies they are using now, what are the policies which comes under this national healthcare program, etc. Okay, you will understand that. So program, you can, if you want an example of program, national healthcare policies and programs are the best examples for this. They, when you talk about program, everything is mixed in a program, from mission, rules, budget, everything is mixed within a program. Next, the final is budget. Budget means you are assigning a numerical value to your plan. Each and every step of a plan which you have, if it has a numerical value assigned to it, in terms of money, in terms of manpower hours, working hours, labor hours, etc. Okay, if you are assigning a numerical value to each and every step of your plan, you are making a budget, and there should be a sum total at the end of a cumulative sum of all the numerical value which you have assigned to each and every step of a plan. There should be a sum total at the end. Means what? You have a budget at your hand. Okay, it's a numberized plan. In the textbook it is given budgets are numberized plans. This is about the hierarchy of plans. Just go through the page number 73 once, just read through it. It's very easy to understand. If you have any further doubts, you can ask later. Now, importance of planning. As I had told earlier, the importance of planning will apply similarly even if you are a small business, large business, in whichever sector you are, private, public, and whichever part of the world you are. The importance of planning, the steps of the planning will apply same to everyone. Planning will come first. It's the first management function you study when you move forward. Okay. The first importance of planning is the primacy of planning. Planning precedes all the other managerial functions. It's the first step of all the other managerial function. In previous classes, Dini madam has also told you in brief about PODSCORB, which you have to remember. The PODSCORB is an abbreviation: planning, organizing, directing, staffing, coordinating, reporting, budgeting. Okay, this is the full form of PODSCORB. Even in that, you can see planning is the first aspect. So primacy of planning means it precedes every management function. The second importance is it offsets the uncertainty or change. Offset means what? To counteract. You all know the future is unpredictable. You can't predict anything about the future. Okay, but if you have a plan at your disposal to just fall back to when there is an accelerated change in front of you, it becomes much more easier to handle that change. Okay, if you do not have any plan and you're directly jumping into a situation without knowing what is next, okay, without a plan it will be very difficult for your management survival. But if you always have a plan at your disposal, it's always easier to fall back on that plan when there is an uncertainty or when there is a change. Okay, next, to focus attention on the objective so that you do not deviate from your management's, your institution's vision and mission. Okay, having a plan at every department level, it makes sure that everyone in the organization is working accordingly to the mission and vision of the organization. To help in coordination, planning brings together all the interdepartmental relationships, all the departments it will bring together. We'll see that when we discuss about the management by objectives, MBO. Okay, in that you will understand this much better. To help control, when you have plan at your disposal, if things go in slight deviation from your expected way of action, you can easily identify that. Okay, something is going wrong. It is easier for you to control that, correct that deviation, and again bring back those changes again to the same course of action which you have decided earlier. So that is another importance of planning, to help in control. Control means what? Something is going out of deviation, something is going not according to what you have planned, you have to bring it back to your focused course of action. Okay, so that is control. To increase effectiveness, to make the organization more efficient in their management function. So these are the importance of planning. Just read through it, understand what is how planning helps in management. That's enough for that. Just the headings, it should you should be clear with what the headings mean. Next is steps in planning. The first step is perception of opportunities. Perception of opportunities means what? For example, let's say something went wrong in your hospital. Something went wrong. You can think any example which is coming into your mind. Okay, something went wrong. Okay, that itself is an opportunity to plan something to correct the things which went wrong. Okay, fill that example of your own so it is easier for you to remember. Opportunity means what? A mistake can also be an opportunity when it comes to planning. So perception of opportunities means what? If you're a manager, top level, middle, or lower level management, you have to keep an eye out for the opportunities which may come in your way where you have to start a planning process. So the first step in planning is having the opportunity to plan itself. Okay. The second step is establishing objectives. Just how I told you the difference between mission statements and objectives. Okay, mission statements, like the perception of opportunities, it is very general. You may have a picture in your mind, okay, but you have to put that picture into writing, into attainable statements. Okay, that is establishing objectives. Objectives will specify the results which you have to gain through this plan, and it indicates the end point of what is to be done, where the primary emphasis is to be placed, what is to be accomplished by various types of plans. Okay, it is very specific. Just by reading the objectives itself, you will understand how you have to go about in your action. But just by reading the mission, you will not have that clear picture. Okay, you will have a clear picture of the dream, but you will not have the clear picture on how to achieve that dream. The clear picture, the objectives will give you how to achieve that dream. Next is considering planning premises. Again, the same thing. We have seen environmental analysis, both internal factors and external factors you have to check. When you are planning something, you have to understand if you are bringing a change in your hospital. Okay, if your hospital is centralized, now it is going to be decentralized hospital. That's a huge change which is going to come. You have to consider the internal factors. Internal factors, for example, the staff, how your staff will respond when the change is brought into practice. Will there be a resistance from the internal factors? Will you have the same customer and patient inflow after you bring about the change? Okay, before implementing the plan, you should do all this analysis. External analysis, when you are decentralizing your hospital from centralized to decentralizing your hospital, in externally you have to see the method of decentralization you are going to take. Will the accreditation be affected by this method? Okay, will the government give you any issues? Will the law enforcement give you any issues? Okay, these all becomes the external factors which you have to check. Just an example. Okay, so considering planning premises means what? Premises, the environmental analysis you have to check first, internal as well as the external. Examples of internal and external is given in this second paragraph in page number 74. Read through that, you will understand. Then identification of alternative. Remember this point, step 4, 5, and 6. These three steps are a very important, very important step when it comes to decision making. That will be the next chapter. Okay, identification of alternatives. In simple words, you should not just have plan A, you should always have plan B, C, D, how much ever possible. That's a simple example which I can give here. Alternatives, having plan A, plan B, C, D, E, how much ever the list can go on. Now, evaluation of alternatives. You have plan A, B, C, D, the list goes on. Evaluation of alternatives means what? From all these plans, you have to select the best plan possible for your organization. The best, how can you select the best plan? The plan which will give you the best outcome, the best result at the end, and which is easier to achieve with less amount of resources. Okay, that is the best way of identifying the best alternative and evaluating the best alternative. Okay, and you have to do many feasibility studies also. That is the technical aspect. Just to understand it, now understand that think the plan which will give you the best possible outcome with less input of resources, that should be your choice of alternative. So these three steps: identification of alternatives, evaluation of alternatives, and finally the choice of alternative, choosing between plan A, B, C, D, whatever the list you have. Okay, choosing from that alternatives, you're choosing one plan. You can't go with two plans together, only one you can choose. You're going with that plan. This becomes your decision making step. So decision making itself is a part of planning. Okay, now formulation of supporting plan. Here the sequence of activities is determined so that plans are put into action. For example, you want to you have a plan of building a new pharmacy. You already have an old pharmacy, but you want to extend it. You want to do some construction and you want to extend the pharmacy facility. Okay, that is your plan as of now. And that will, you have done all the other feasibility studies. Shutting down the pharmacy will not work. Giving your pharmacy to an external uh, to a private sector operator will not work. The only best thing you could come up for was, the best alternative for you was to do an extension of your current pharmacy. Okay, that's the plan. Now formulation of supporting plan means what? You have to bring in the architect to see how feasible it is to extend the uh, pharmacy. You have to bring your maintenance department to see how the electrical electrician work and everything should go about. Okay, you have to talk to your pharmacy department itself, how many new employees they may require. Will the old number of staff may will they can they handle this new extension? How it is going to interfere with their current work, etc. Okay, so they all will bring plans from their side to support your original plan of extending the pharmacy. Understood? You have a plan, but even to make that plan into action, you need many supportive plans from various other departments. So that is formulation of supporting plan. And finally, budgeting, putting a numerical value in terms of money, manpower, labor hours, machinery hours, etc. Putting this numerical value into your plan is called budgeting. So this is the 8 steps in planning. Detailing it is given in your textbook. You can read that once. Even if once you read it, you will understand the meaning which the steps are indicating. Okay, it's page number 74, steps in planning. Now, objectives. These are the end results which you have to achieve. Even in the quality class also, we have talked about the SMART objectives. So your objective should have these 5 characteristics. Then only you can say your objective is a SMART objective. You can attain that objective. So these 5 characteristics, every objective should have this. Okay, so for example, let's take weight loss. If I say I want to lose 5 kilo in a month, okay, I want to lose 5 kilos in a month. So that is specific. I am stating what I want to do. Okay. And it's action words, means I'm going to lose. I'm going to lose 5 kilograms in a month. So I'm being specific with that. Okay. For example, if I say I want to get healthy in this month, I want to lose weight in this month, I want to lose 5 kilograms in this month. From these three statements, these are 3 different statements, you can understand which statement was very specific. It was the last statement where exactly I told how much kilograms I want to lose and within what time I want to lose. Okay, that is the specificity of an objective. Next, measurable. When I am losing the weight and all, how will I measure it? Is there a measurement tool which will enable me, which will help me to understand that, okay, yeah, I am on the track. So here, if the goal was losing weight, how will I measure that goal? In the course of action, not at the end, during the course of action, obviously using a weighing machine. Okay, so weighing machine becomes a measuring tool here. Your objective, you are able to measure your objective also. Okay, that's the measurement characteristic of objective. Next, achievable. Is it do you have any previous health conditions which will stop you from losing this many weight? Is it achievable by you? If I say I want to lose 20 kilos in a month, it's not achievable. Okay, it's not possible. But if I'm putting some realistic goals in front of me, okay, then if for example 5 kilos, 4 kilos, it is realistic, you can do that within a month. Okay, a person with common sense, they know that they can do that. But if you're highing too high, aiming too high, okay, that cannot be achievable. So your objective should be achievable within your with the resources which you have. Relevant, it should make sense within the your job function. With the example which I'm saying, you should have the resources relevant or it is realistic. In textbook it is given realistic, here I have used relevant, both are the same. Okay, what relevant or realistic means is you should have the resources to achieve this objective. For example, if you're going on a weight loss journey and all, do you have time to exercise? That is an hour. Time is also a resource. Okay, that's an hour. Do you have a time for exercise? Do you have dietary supplement? Do you have a dietitian who may guide you? Or do you have access to good foods that will enable you in your weight loss? Okay, these are the resources which is relevant for your objective to attain the objective. And finally, your objective should be time bound. Your objective should not go on and on. By the end of this month or by the end of this year, I should attain this. Okay, I should achieve this. That is an objective. That's a smart characteristics of an objective. You can apply this smart technique in, even if you're a research student, if you're doing any research in your undergraduation, post graduation, you must be more aware about this when you're making your thesis and everything. When you have to state your objectives, your guides may have put a much focus here in this in making your objectives as smart as possible. Okay, so specific, measurable, achievable, relevant, and time bound. Now, management by objectives, MBO. So in quality class, I have took a chapter called Kaizen. Okay, so it's more or less very similar to management by objectives. Okay, so MPO, it is a process where superiors and subordinates jointly identify the common objective. Here I have made this sentence in bold: superiors and subordinates. They have to come together and they have to identify the common objective and focus to work on that. Okay, we'll see that how it comes to play. We'll see that now. Okay, now set the results that should be achieved by the subordinates. When this meeting happens, the superiors will guide the subordinates. By this time, your department should complete this. Okay, for example, you want to increase the patient satisfaction, overall patient satisfaction in your hospital. That is your objective. Okay, the CEO will say, we are getting too many complaints from our patients. We are getting negative feedback from our patients. So we have to come together. We have to do something about it. The founders and the CEO will not have this discussion among themselves. They will call the in charges and the managers from all the department where patients are having a direct communication with the staff. From all these department, the in charges and the managers will be attending this meeting. The superiors, the top level management and the middle level management, they will guide their subordinates. They will guide, for example, if it's the radiology department, the doctor in charge, the radiologist in charge, he will be guided how he has to function to bring about a good patient satisfaction from his department. The nursing superintendent will be guided. So on. All the department heads will be guided by the superiors to bring about this positive change. These in charges will further give their own guidance to the staff involved, to their subordinate. So it goes like subordinate to subordinate. And management by objectives means what? The objective of the founder and the CEO, the top level manager, was to get positive feedback from the patients in general. Overall patient satisfaction should be good. Now, each of the subordinates, the end workers, will also have the same objective. While they are working now, from now on, when they are working, they will have this objective in the mind. They will be undergoing proper training. They will be given proper dusting down from their department heads, everything. They will take care of this issue. So what is happening is top level managers, superiors objectives and the subordinates objective is coming together. Their actions are focused in one direction of attaining this particular objective. That is management by objective. It's not a technique, it's not a tool, it's more like an attitude which the entire organization should have. That's why I told you it's more or less very similar to Kaizen. Then you have to assess the contribution of each individual. Whomever you are going to give orders to, is that individual doing their work, or are they coming up with the desired results which you have ordered? Okay, so each contribution from each and every individual should be assessed. That's why we have performance appraisal as a very key theme in management by objectives. I guess you must be knowing what is the meaning of performance appraisal: rewarding the employees when they do good work, and dusting them down when their work is not correlated to your objectives. Okay, integrate the individuals with the organization so as to make the best use of organizational resources. Whatever you have at your disposal, it has to be utilized in a very systematic manner, that there should be no waste. And the individual should also know, the people handling these resources also should know not to waste them, use them judiciously. Features of MBO, I told you earlier, it's not a tool or technique, it's more of an approach, and it's a philosophy. MBO is likely to affect every management practice in the organization, just like the example which I gave you. When it comes to overall patient satisfaction of the entire hospital, you can't just dust down one particular department. Each and every department where the patients have direct communication with the staff, they all are equally important when it comes to achieving that particular objective. That is why it will affect every management practice. Within a hospital itself, there are 10 to 20 management practices, from the top management to the operation level, from the CEO's office to the maintenance department. Okay, MBO is bound to have some relationship with every management technique. For example, I gave you a management technique of Kaizen. Okay, so somewhere it is interrelated. And Kaizen is a management technique which is used in quality and Six Sigma. Okay, so wherever you go, there is a management, there is a business administration, that's a management. MBO has a scope there, even if they want to do their work through MBO or not. Okay, if they want to use this philosophy or not, but MBO has a scope wherever a management tagline is attached to a department. Okay, the basic emphasis of MBO is on objectives. Means it is very result oriented. Whatever is the objective, short term objective, very specific, and it is very result oriented, and it will always try to match the objective with the resources. It will not make up the objective which is far away from the resources what you have. Okay, whatever you have, the resources, the manpower, money, how much you can afford, okay, how much your organization can afford, within that limit only MBO will create its objectives. It will not go beyond the limit of the resources of the organization. The MBO is characterized by participation of concerned managers. As explained earlier, not just one management department is involved. The objective stated by the superior, which all department comes under that particular objective, all the department heads are involved. Periodic review of performance appraisal. MBO will provide guidelines for the course of action which has to be put into place. Systems approach to MBO. Not only systems approach to MBO, but whenever you hear of this term, systems approach, this particular input, operations, output, this thing should come into your mind. Okay, remember that. Whenever you hear the term systems approach, this chart should come into your mind: input, operations, and output. Here, some of you can give me examples. When it comes to hospital, input, there are raw materials, people, capital, information. Can anyone give some examples of inputs? From your perspective, what do you think input in a healthcare environment is? Raw material, let's start with raw material. What can you give me an example? Inputs are usually the resources that the hospital has. We'll take here the example of, okay, pharmacy stockpile, building, capital. Yeah, building will come under capital. Yes. Pharmacy will come under the raw materials. Yes. Instruments. Yes. Medical equipment. Yes. People. What about people? Nurses are input. Doctors are input. All the staff, all the healthcare practitioners are inputs. Okay, so people here, people is, yeah, staff, personnel. And capital means, for example, building itself. Okay, that is one capital. The second example is capital equipments in a hospital. For example, you have CT scan, MRI. These all are capital equipments in a hospital. Okay, you have to put a lot of resources in terms of money. Okay, if you're buying this equipment, so these are capital equipments. You have to put a lot of money, and you have to use this for a very long time. Information. Can anyone give me an example of information? Very simple. Yeah, patient case history, kind of. Medical records, yes. Health education. Health education given by, health education which the knowledge of information the doctors and nurses already have. IT technology will also come under information. Okay, so I guess you've got a idea of what inputs are. What will be the operations, activities that add value to raw materials? Any procedure that we perform, yes. The nursing services, the pharmacy services, the medical services that the physicians and the surgeries that take place. Okay. Housekeeping services. Those all come under the operations. Next, outputs. Services or finished goods released into the environment by the organization. What would be the output? Example of output. Patient satisfaction is also an output, and also it's feedback also. Output says, for example, from hospital point of view, I can say healthcare associated infection, the rate of healthcare associated infection, readmissions, admission rate, morbidity rate, mortality rate. Okay, all the key result areas, length of patient stay. Understood. These all comes under the output for hospitals. We are taking the examples only for hospitals in this systems approach. Systems approach you can apply in any industry. Okay. And finally, feedback. Feedback means the patient satisfaction. And when you get the feedback, again, if it is bad, if the feedback is negative, you have to bring some changes. You have to bring some changes from the input. You have to get superior quality raw materials. You have to get well trained and well skilled staff. If your capital equipments are not working, your building is too old, it reeks smell from all the walls, ceilings, everything, you have to bring some construction changes there. If you do not have an IT, a strong IT technology in your hospital, okay, if you are not providing good health education via posters sticked on the wall and etc., okay, you have to bring the changes here. And how you will bring the changes, it depends upon the feedback from your output. Okay, so this is a systems approach to MBO. Now, benefits of MBO. You can just read through the benefits. It obviously better management of the organization, hospital here. Okay, clarity in the organization's action. Now, even the lower level managers and each and every employee of the hospital, they will know why the superiors and why the top level managements are making such decisions. Okay, that is clarity in the organization's action. Personal satisfaction, it's very questionable. Okay, sometimes MBO can dump a lot of responsibilities on the managers. So at managerial level, sometimes personal satisfaction is not always the case. It is questionable. Okay, basis for organizational change, it will lead to some changes. MBO will lead to some changes. Limitations of MBO, obviously time and cost. You have to bring a meeting up. The managers have to leave what they are doing. They have to come up when they are, when you create an objective. If it is something, for example, like capital. Okay, your CT scan and MRI scanner are way too old. It's becoming absolute. Okay, you have to invest in a new CT scan and MRI machine. Okay, so it comes with a cost. Such objectives will come with a cost. Okay, failure to teach MBO philosophy. I told you, MBO is less of a technique and it is more of a philosophy. And not everyone is as philosophical as the top management. Understood? So management, top management want to bring some change, but there would be some resistance from the lower management or other subordinates. Okay. Problems in objective setting. You know what you want, but you do not know how to get there. Okay, think of any unsolvable issue in your workplace and you're finding some difficulty in setting objective to reach your aim. That becomes an example for this problems in objective setting. For example, high nurse turnover ratio. Most of the hospitals face this issue. Nurse turnover ratio, the it's less than a year or it's almost 6 months, something like that. Okay, they are ready to give the salary or something, but due to many other external factors, the nurses don't want to work in India. Mostly they want to go abroad, or all personal reasons, etc. Okay, that's a problem in objective setting. They want to control the nurse turnover ratio, but they do not know how. They have exhausted of all the options by giving increment, by giving them incentives, etc. But still they are not able to control their nurse turnover ratio. Most of the hospitals. Okay, so that's one problem in objective setting. Emphasis on short-term objective. When all from top management to the lower management, everyone is coming together, they are not thinking 10 years from now or 15 years from now. Long-term plans will just take a backseat when it comes to MBO. It's always short-term plans. This month we are having very less patient satisfaction. Our feedbacks are mostly negative. We need to do something so that next month we will have a good positive feedback from the patients. Okay, so it's like monthly, quarterly, yearly. Okay, sometimes management objectives may in very rare cases it may go up to 5 years or something, but usually what happens, whatever long term goals or objectives your organization had, if you go by MBO, those long term goals will take a backseat. Inflexibility, I told you earlier, some employees may show resistance to the top management when they are bringing up their objectives and they are dumping their objectives to their subordinates to follow it. Okay, without listening their concern or their thought, school of thought. Okay, some issues may come up. That is resistance or inflexibility. And frustration among the employee and also the top management if the objectives, even after giving proper guidelines, guidances, skills, training, etc., you're not able to achieve the objectives set by the top management, it will create frustration on both the sides. So that is the limitation of MBO. Thank you. Yeah, the last slide was that systems approach. It is not given in the book, but it's a very important topic. Systems approach is a very important topic that as a management student you should know. Just Google it about systems approach. If you can read a few good articles, and like you will get a good knowledge about that, about the systems approach. Whatever was possible from my side, I did that because the in book it is not given. They have just given a small paragraph on systems approach, but they have not given any figure or any picture for that. So I hope you have a better understanding of what is planning and what is management by objectives now. If at all you have any more doubts regarding this, please